Hello, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for June 16th, 2021. Thank you for joining us this month. Our presenter today is Sandra Soto. Dr. Soto is an assistant professor in the UNC Chapel Hill School of Nursing and Thurston Arthritis Research Center. Her research focuses on the social influences of physical activity and dietary intake among Hispanic individuals. By incorporating Hispanic cultural values, Dr. Soto's research aims to develop effective behavioral modification interventions to prevent and manage chronic diseases, including osteoarthritis. Her talk today is entitled, Exploring Social Motivation for Physical Activity Among Latinas with Osteoarthritis and a Member of Their Social Network. Dr. Soto?
Thank you, Katie. Before I begin, I would like to point out that this presentation comes from a study that was published last year in Arthritis Care and Research. I believe Katie will include a link to that paper later this week. I'd like to start by providing a brief rationale for why I'm focusing on Latinos with osteoarthritis, or OA, specifically Latina women in this study. First, Latinos are more likely to experience more severe OA symptoms than non-Latino whites. Latinos are more likely than non-Latino whites to experience activity and work limitations and more likely to experience severe joint pain. Second, Latinos meet physical activity guidelines at lower rates than other groups. The national guidelines are to engage in at least 150 weekly minutes of moderate to vigorous physical activity. Now you can see on this graph that adherence to national guidelines is low across the board. However, they are lowest among Latinos. And third, when we zero in on the physical activity of Latinos by gender, we find that women engage in less physical activity than men. Unlike the last graph that showed the percentage of individuals meeting the guidelines for weekly moderate to vigorous physical activity minutes, this graph shows the total amount of daily activity, which includes light, moderate, and vigorous minutes. And as you can see, women engage in fewer daily minutes of any physical activity than men. So what influences physical activity? Well, there are several levels of influence, beginning with the personal level, which includes things like self-efficacy or the confidence to be physically active and perceived barriers to physical activity as examples. Social influence comes in the form of having companionship during physical activity, which is highly motivating for some, especially Latinas, or receiving social support for being more active. And finally, cultural influences can play a role. Within traditional Latino culture, there is an emphasis on the interdependence rather than the independence between people. So that the decision to be physically active or to become more active is highly influenced by members of our social network, including family members and friends. And it's because of this emphasis on family and friends that examining the role of social influence on the physical activity of Latinas becomes that much more important. However, most physical activity interventions for adults with OA target personal level influences, and most focus on non-Latino populations. So the purpose of this study was to explore how Latinas with OA and a supporter of their physical activity motivate each other's physical activity. So in this study, we used a qualitative design using semi-structured dyadic interviews with Latinas with OA and a member of their social network who supports their physical activity efforts, who we call the supporters. Latinas were recruited from a database of local clinics at UNC and at a senior center in person. Latinas had to have knee and or hip OA and had to nominate a supporter of their physical activity who was willing to participate in the interview. And supporters had to be at least 16 years old. Interviews were conducted in participants' preferred language. Most interviews were conducted in Spanish, a few in English, and one was conducted in both English and in Spanish. The interviews were digitally recorded and then transcribed verbatim in their language of origin Any quotes that I shared that may have been spoken in Spanish were then translated into English. We used an interview guide with open-ended questions, and the interviews lasted between 60 to 90 minutes, and each member received $20 for their time. Here is a brief glimpse at the interview guide, which covered topics on physical activity and social support, OA and physical activity, and OA and social support. To analyze the data, we used framework analysis, which uses a systematic approach to identify themes within dyads and between dyads. We first developed a code book that was created based on the interview guide, and then it was adjusted after 2 bilingual coders separately coded 4 interviews that varied by language and by dyad type. And then the transcripts were coded using that code book, and codes were hierarchically grouped to reduce the data to themes and subthemes for interpretation. Themes and subthemes were initially examined using all of the data. Then the data were categorized by participant type, so by Latinas with OA and supporters, and by dyad type, for example, by couples or mother-daughter dyads. And themes and subthemes were examined across the various groups and then compared and contrasted between groups. Here are the participant demographic characteristics. I won't go over all of these characteristics, but in brief, Latinas with OA were on average 66 years old, half were married, half completed high school, and most were born outside the US. Supporters were on average 48 years old, most were married, most completed high school, few were born outside the US, and half were women. The supporters consisted of 5 daughters, 4 spouses, 2 sons, 1 granddaughter, 1 nephew, and 1 friend. We identified 4 overarching themes with numerous subthemes that I'll review in the following slides. The themes included how participants support one another's physical activity, how OA symptoms impact support for physical activity, how OA symptoms impact the physical activity of Latinas with OA, and how OA symptoms impact the physical activity of supporters. For the first theme, this first subtheme focused on reciprocated motivation between the participants. Motivation and support were not always unidirectional, flowing from supporters to Latinas. Some dyads reported that support for physical activity was reciprocal, flowing back and forth between them. These dyads described relying on each other for support and providing additional support when the motivation was lacking in one person. So this mother said, "In fact, we motivate each other, her and I." The most common way that participants said they provided and preferred to receive support was by engaging in physical activity together, especially walking together. Across dyads, the commitment to exercise together varied, with some having a recurring appointment and others creating opportunities to exercise together on occasion. So this daughter said, "Usually my mom is the one who tells me, 'Let's go for a walk.' We try to go once a week." Using pressure to get the other person to be more active was rare among marital couples and typically given by Latinas rather than by their spouses. Although pressure was not universally embraced among dyads, it was welcomed and deemed useful among those who did receive this type of influence. So this mother said, "My son tells me, 'Go to the gym, go do that.' Did you go to the gym? Have you done the exercises prescribed by your doctor?" "Yes," I tell him, "I've done them. He motivates me a lot." Participants said that they supported each other's physical activity by talking about it. Topics of discussion often focused on using physical activity to prevent or manage long-term diseases, overcome barriers to physical activity, or in general conversation around exercise. So for example, this mother said, "Yes, Sometimes when I see her after she exercises, I ask her, how was your day? Or how was the exercise? What did you do? What did you like? What didn't you like? Latinas with OA and some of their daughters said that help with household responsibilities made it possible for them to be active. So for example, this daughter said, sometimes I'll tell my mom, can you watch my dog a little while longer? I'm going to my gym class. Modeling physical activity was a motivator, but only for Latinas with very active supporters. For example, an aunt of a nephew supporter who works in a gym, and a grandmother of a granddaughter supporter who is a dance teacher. So for example, this grandmother said, watching her dance motivates me. Moving on to the second theme of how OA symptoms impact support for physical activity. Latinas expressed a desire to receive support for physical activity when they experienced OA-related pain and stiffness. They desired additional support during these times because they believed physical activity could ease their symptoms, but their pain and stiffness impeded their motivation to be active. So this wife said, there are moments when you're in a lot of pain and you don't want to even move. In that moment, I do need someone to tell me, do it so that the pain will ease. Some Latinas with OA said they did not discuss their OA symptoms with their supporters because they did not want to complain and burden their loved ones, especially if they believed that there was nothing that can be done for OA symptoms. For example, this mother said, no, I don't talk about pain, and she laughed, never. The inability to recognize OA-related symptoms in their daughters resulted in misunderstandings from some mother-daughter dyads. This lack of understanding led to mothers express frustration that their daughters did not grasp the extent of their pain experience. In these cases, mothers tended to decline invitations to be active when experiencing OA symptoms. So for example, this mother said, she looks at me and says, are you angry? She often asks me, why are you mad? Or are you mad? And sometimes I tell her, no, daughter, I'm just tired, in pain. Conversely, negative situations were avoided when both participants had OA and could empathize with each other's symptoms. So for example, this spouse said, when something happens to her related to the arthritis, I also feel it. Why? Because I have also felt the same pain, and so we motivate each other to do exercise. Now moving on to the third theme, how OA symptoms impact the physical activity of Latinas with OA. Overall, dyads believed it was a good idea to be physically active when Latinas were experiencing OA symptoms. Reasons for this centered around the belief that movement could alleviate pain and stiffness and is a preferable alternative to surgery as a treatment for arthritis. So this friend said, yes, I was telling her, maybe if you go exercise and do lots of activities of all your muscles, your leg muscles, maybe need to reinforce it. Myself, I'm less for surgery. I'm more proactive with the exercise. Still, some did not believe it was a good idea to be active while experiencing OA symptoms, or they were unsure. Although they believed physical activity was beneficial to OA, these participants expressed concern that it could cause harm in the joints when symptoms were present. For example, this granddaughter said, I think maybe I'm not informed, but when I see her suffering, I'm like, don't do anything, more as a precaution to prevent her from wearing herself out more. That's how I think of it. Surely I'm wrong. I don't know. Some reconciled their ambivalence about the safety of physical activity by deciding that it was a good idea unless those symptoms were severe, in which case taking it slow by doing gentle stretching or yoga, walking, swimming, or even resting was the best approach. For example, this daughter said, I think exercise when in pain depends on the pain, because a lot of times if you're stiff and in pain, throughout the day you warm up and feel better. Maybe an activity that's very light, but not to stop moving. Now on to the last theme, how OA symptoms impact the physical activity of supporters. Some supporters, typically spouses, explained that they were less likely to engage in physical activity when their partner experienced OA symptoms. This was because spouses often relied on the support from Latinas to be physically active. For example, this spouse said, "It's a barrier because, like I said earlier, I don't like doing exercise by myself." Supporters also explained that they were less likely to engage in physical activity when Latinas were experiencing OA symptoms because they would opt to stay home and care for them rather than leaving them to do physical activity. Other supporters explained that they became more active when Latinas experienced OA symptoms. A few said that this was because they took on more household chores, thus engaged in more activity. Others, typically daughters, said that seeing their mothers in pain motivated them to become more active to prevent the onset of OA for themselves. Similarly, mothers used their pain experience as an example to encourage their daughters to become more physically active. So here this daughter says, "Seeing her like that in that moment is motivation for me to not end up like that. It's exactly the reason why it's important to keep moving." So we learned that Latinas typically rely on daughters as a source of social support, and this is consistent with prior research. However, most physical activity interventions that do focus on dyads have generally focused on marital couples. Therefore, an essential next step for research is designing dyadic interventions that both include non-spouse supporters as well as spouse supporters. We also found that social support for physical activity is received and given by Latinas with OA, especially when both participants are relatively inactive. When physical activity is not yet a habit, providing support may promote physical activity above and beyond receiving support. Thus, reciprocated support may explain why including dyads in physical activity interventions may be more effective than enrolling participants alone. We found that walking was a common method of engaging in physical activity together. In addition to being accessible and easily modifiable, walking is deemed safe and recommended as an effective self-management method of reducing OA symptoms and should be encouraged. Our findings showed that most Latinas wanted additional support for physical activity when they experienced more severe OA symptoms and needed help overcoming physical activity barriers. Unfortunately, many supporters in our study were unaware of how to provide physical activity support when their counterpart experienced OA symptoms. This is why educating not just the person with OA, but also loved ones is important to promoting a more active lifestyle. And finally, adult children and their mothers may have an awareness of children's elevated risk for OA and may become prompted to engage in healthy behaviors in the presence of OA symptoms. Given the reciprocated nature of support and physical activity between mothers and their children, engaging family members who see themselves at high risk for OA may lead to more physical activity in them and in the person with OA. One strength of this study was that we included a variety of supporters. Also, the dyadic design of our study enabled us to identify examples of reciprocity between participants and address research gaps that only focus on the personal level of influence on physical activity. However, the qualitative design of the study may not generalize our findings to other populations because our sample consisted of Latinas with OA and a supporter of their physical activity recruited from an urban area of North Carolina. Our findings cannot speak to Latino men with OA or support provided by individuals not represented here, for example, healthcare providers. Also, we did not include supporters who did not live locally, but may provide support remotely. We are using the findings from this study to develop and test a dyadic intervention for Latinos with OA and a supporter. This study is called Muévete con Apoyo, or Move with Support, and it builds on the evidence-based walking program, Camine con Gusto, or Walk with Ease. This study will test different dyadic intervention strategies to promote walking in both Latinos with OA and their supporters. I'd like to acknowledge my co-authors, Dr. Diane Berry and Lee Callahan, and funding for this project. Thank you. I'm open for any questions. Thanks.
Thank you, Sandra. That was really interesting. For those of you on the call, please feel free to put any questions in the chat box. It looks like we have one here. For doctoral students interested in researching social or behavioral aspects of OA, what do you recommend? Are there possible connections to make, possible organizations to reach out to?
Well, I would be happy to talk to any doctoral students interested in this area of research. Organizations. I'm going to have to think about that. Maybe if you can connect me with them, Katie, I can send them some potential connections. Yeah, but that's great. But if she can connect with me directly too, that would be amazing.
That's great. Yes, thank you. Thank you for that question, Stephanie. We'll get you connected. And also there's a suggestion that you can reach out to the Thurston Arthritis Research Center. Thank you for that question. Sandra, I was wondering if you identified any barriers to physical activity among the Latinas other than pain. I know you mentioned pain. Was there anything else that got in their way of physical activity?
You know, one common barrier I'm sure everybody can relate is time. So really, you know, just fitting it into one's daily schedule is something that's really hard if it's not become a habit yet, if it's just not a part of their lifestyle, is just figuring out ways to include it, either, you know, separating a chunk of time or integrating it throughout the day with small, you know, little steps here and there. Also the recognition that there is activity that they're doing that they don't recognize as activity. So household chores, that is an activity, you know, depending on the chore, it can be more vigorous than others. So, you know, even though washing the dishes is not very vigorous, it's pretty light activity. It's more than, you know, sitting on the couch. But things like vacuuming, things like gardening, there are some housework that, you know, can be maybe included more. If, you know, obviously with Latinas, there is a sense of obligation of keeping the household. And so if you can, you know, sort of show pointers of how to maybe incorporate more vigorous activity around household activities, then they wouldn't feel pulled away from my responsibility in the house, but could still incorporate physical activity throughout the day.
No, that's interesting. So just kind of helping educate them about different ways that they can be more physically active in their regular activities.
Right.
And you mentioned the study there at the end. Could you tell us a little bit more about the Move with Support study?
Sure, I would love to. So this study, it just got started almost 1 year ago. It's a 5-year study where we are developing and testing this dyadic intervention. So we don't know much about which dyadic strategies work. You know, we know a lot about what works when we focus on individuals and interventions, right? Like goal setting, you know, tracking your steps, tracking your goals, like all those things work, improving self-confidence, you know, self-efficacy. But we're not exactly clear on what dyadic strategies may be effective. So if we're going to include 2 people in an intervention, we need to find that out. So the purpose of this study is to first, for the first 2 years, we're developing and we're pilot testing different strategies and really learning from the community. So we're asking them to keep a diary of as they go through the project, of what worked, what didn't, asking them afterwards in qualitative interviews together, you know, what was kind of burdensome, you know, did you really enjoy this? What kind of worked for you? And then in the last 3 years of the study, we're actually going to do a randomized trial where we do test for efficacy to see what's making an impact on steps, on moderate to vigorous physical activity, on all those metrics of physical activity. And we're interested in both partners, right? Because we see from, for example, from this evidence of the study that there is a reciprocating influence between partners. So if we can get one to become more active, the theory is that they'll then pull the other to become a little bit more active with them. So we're really interested in what happens with both partners, not just the person with OA.
That sounds exciting. We'll have to have you back on in a couple of years so you can give us the results of what you find.
Thank you.
And here's a question. This will be the last question. Did you find any difference or interesting themes between younger patients with OA versus older patients?
Well, most of the patients, the participants were older. They were, more limited in their age range. We did have one couple that was younger. And I would say the difference there between this couple was that it was more about, like, there was the example there about, I can't be active when she's having OA symptoms because she sort of motivates me, and without her motivating me, I can't do it. Versus older couples that were saying, it's not really, it's a little bit about that, she motivates me. And so I kind of don't do anything when she's, actively in pain, but it's also about me taking care of her. So with older participants, there was more care needed when arthritis symptoms were present, that sort of forced them to stay home and not be, not go exercise or go for a walk or anything. So there was more care involved with older participants. Other than that, I didn't notice anything, but the range in age didn't vary as much with most participants.
Thank you, Sandra. We appreciate your presentation, and thanks to all of you for joining us today. That concludes our presentation. I'm going to put a poll up here if you don't mind answering a few questions before you leave. And just a reminder, we will be having another Lunch and Learn on July 21st. That will feature Nick Bursick, Director of Communications at the OA Action Alliance, who will present evaluation of the Holiday Walk with Ease campaign. Thank you all so much and have a good day.
Thank you.